Okay, for every endocrinologist, for every clinician out there managing menopause, something huge has just happened. We're talking about a seismic shift. After 23 years, the FDA is completely reversing its stance on hormone therapy. This is a big deal because this guidance has shaped clinical practice for an entire generation. So let's break down the science that finally dismantled this two-decade-old dogma, get into the details of the timing hypothesis, and figure out what this landmark decision means for you and your patients.
And just listen to these words. An American tragedy, one of the biggest mistakes in modern medicine. You know, this isn't some critic on the outside looking in. This is the FDA commissioner himself, Dr. Marty Makary. That statement is just incredibly powerful. It frames this whole thing not just as a policy update, but as the correction of a profound error that's affected millions of women for over 20 years.
And here it is, the headline news. On November 10, 2025, the FDA officially started the process to remove the black box warning, and you know that's the agency's most serious, most stringent warning from the majority of MHT products. This is a 180-degree turn from the policy put in place way back in 2003, a policy that, in Dr. Makary's own words, basically created a fear machine around these therapies.
So, I know the question on every clinician's mind is, why now? What could have possibly changed after 23 years? Well, to answer that, we've got to go back. We need to deconstruct the study that kicked this all off, see how a fresh look at the old data sparked a completely new hypothesis, and understand how that new thinking finally forced this massive regulatory change.
Okay, so let's get specific. What's actually changing? The big ones. The boxed warnings for cardiovascular disease, breast cancer, and probable dementia, they're coming off. This applies to systemic estrogen, the estrogen/progesterone combos, and topical products. But, and this is absolutely crucial, the warning for endometrial cancer risk when you use systemic estrogen alone therapy without a progestin, that's staying. So this isn't a free-for-all. It's a very targeted, evidence-based revision.
To really truly understand why 2025 is such a landmark year, we have to jump in a time machine and head back to 2002. We're talking about the Women's Health Initiative, the WHI. This was the study, the bombshell, that brought the world of endocrinology to a screeching halt and kicked off all the fear and dogma that have dominated practice for the last 2 decades.
You know, this timeline really maps out the whole dramatic arc. 2002, the WHI's combined estrogen and progestin trial gets stopped early. The panic sets in. And almost immediately, boom, 2003, the FDA slaps black box warnings on everything. But then, over the next decade, something interesting happens. Scientists kept digging into that same data. And that's when the timing hypothesis started to emerge. And now, all these years later, it's that hypothesis that has finally led to this 2025 reversal.
And here it is. This is the data that caused the collective panic. Just look at these hazard ratios from that original 2002 paper. Statistically significant jumps in risk for coronary heart disease, invasive breast cancer, stroke, and look at pulmonary embolism, more than double the risk. I mean, no wonder everyone was terrified. And yes, sure, there were some clear benefits down here for colorectal cancer and hip fracture, but those top-line risks are what screamed from the headlines and cemented 2 decades of clinical fear.
But here it is. This is the critical context that got completely lost in the noise back in 2002. The average woman in that study was 63 years old. That's more than a decade past the usual start of menopause. And they were using a very specific formulation, oral conjugated equine estrogens plus medroxyprogesterone acetate. That's a world away from the transdermal 17-beta estradiol and micronized progesterone options we commonly use today. So this wasn't really a study of newly menopausal women, it was a study of older women. And as we're about to see, that makes all the difference in the world.
So that critical realization about who was actually in the study, well, that's what gave birth to what we now call the timing hypothesis. As researchers went back and sliced and diced the WHI data in new ways, they found that the most important variable wasn't just if a woman took MHT, it was when. When did she start it in relation to her final menstrual period? That was the game changer.
And this slide just illustrates the whole concept perfectly. It's all about this critical window. If a woman starts therapy within 10 years of menopause, or before she's 60, estrogen seems to work on blood vessels that are still pretty flexible. This actually gives a cardiovascular benefit and lowers all-cause mortality. But if she starts later, say after 60, when there might already be some hardened atherosclerotic plaque built up, the theory is that estrogen could destabilize that plaque and actually increase cardiovascular risk. This distinction right here is the scientific bedrock of the FDA's entire new policy.
So,
You can see how this timing hypothesis completely reframes the entire risk-benefit conversation. It's not that MHT is good or bad. It's that we have to stratify risk based on when a patient starts. So let's look at the data again through this new lens and see what happens to the benefits when MHT is started in the right patient at the right time.
Get this. According to the data the HHS reviewed, starting MHT early can slash the risk of cardiovascular diseases by as much as 50%. I mean, that turns the old story completely on its head. What we thought was a cardiovascular risk is actually a powerful cardioprotective intervention when timed correctly.
And the benefits don't stop there. They actually extend to the brain. That same review points to a potential drop in Alzheimer's risk by up to 35%. This directly tackles that old probable dementia warning and suggests that for younger women, the effect could be the exact opposite of what we feared for so long.
And finally, the impact on bone health is just dramatic. A reduction in bone fracture risk by up to 60%. Now, this was a known benefit even in the original WHI data, but it just got buried under all the scary headlines. It really makes you think about Dr. Makari's story about his own mom, who had 2 fractures and was never even offered MHT because of the fear that came out of that study.
All right, this all leads us to the most important question, right? What does this mean for you in your practice day in and day out? How do we start having these new conversations with patients after 2 decades of telling them to be cautious?
So, here's the new guidance, boiled down. For systemic MHT, the key is to start inside that critical window, within 10 years of menopause or before age 60. That's how you maximize all those benefits we just saw and keep the risks low. And just as important, the FDA is getting rid of the old idea that you have to use it for the shortest duration possible. Now, the decision on how long a patient stays on therapy is an individualized one between you and your patient.
Now, the reaction from the big professional societies has been really positive. You see ACOG commending the decision, the Menopause Society basically saying, "We told you so, this warning was a deterrent." But for the complete clinical picture, it's really important to see this nuanced statement from the original WHI investigators. They're pointing out that no new, large-scale trials have come out that would change their original findings for the specific older population and oral formulation they studied. It's a subtle but important reminder that the details of the evidence really, really matter.
And so this all leaves us with the central question for every single clinician watching. After 23 years of ingrained caution, of fear really, how is this reversal actually going to reshape your patient counseling, your prescribing habits, and the entire future of menopause care? This decision is a monumental step away from old dogma and towards a much more nuanced, evidence-based understanding of hormone therapy. And its full impact on women's health? Well, that's a story that's only just beginning to unfold.